Hello everyone, welcome back to the new video. In this video we are going to deal with the new topic called as incompatibility in pharmacy. Here incompatibility in pharmacy refers to a undesirable interaction between two or more substances. So here the interaction may be physical, chemical or therapeutic. So depending on the interaction between the two or more ingredients, we are going to categorize this incompatibility in three different categories, that is physical, chemical as well as the therapeutic. Physical incompatibility. It occurs due to physical change like precipitate formation, immiscibility, liquefaction or color change without any chemical reaction. Physical incompatibility only due to physical change and there is no chemical interaction or chemical reaction. So it affects only the physical properties of the formulation like immiscibility, for example oil and water, and insolubility, that is the solute may not dissolve in the solvent. Then another example like precipitate formation, like mixing of calcium salt with sodium bicarbonate. And then eutactic mixture, that is when these ingredients are mixed up suddenly from the solid, they will convert in the form of liquid, like example camphor and menthol. This reaction is called as liquefaction. So all these are due to physical change. It is called as a physical incompatibility. Chemical incompatibility. It occurs when substances react chemically, resulting in loss of potency or production of the toxic substances. So the chemical incompatibility, there is a specific chemical reactions which is going to take place. It will affect the chemical properties of the drug or you can say the formulation. So there are many chemical reactions like oxidation reduction reactions, hydrolysis is there, then it may lead to color change. And a few examples are given here, like tannic acid and ferric salt. It gives the black precipitate. Here in this diagram or in image we can see the black precipitate. And similarly chloral hydrate plus potassium bromide plus water, it may lead to liberation of chloroform which is toxic. And similarly potassium iodide when mixed with iodine and water, it iodine gets reduced, so which is also not desirable, or it may produce the toxic effect. So here in brief, chemical incompatibility takes place due to chemical reactions which is undesired, and it will affect the potency as well as the efficacy of the drug, as well as it may cause the toxic production of toxic substances. Therapeutic incompatibility. So therapeutic incompatibility means it occurs when two or more drugs are administered together, result in two effect. Either it may cause antagonistic effect or it may cause synergistic effect. So the condition for therapeutic incompatibility is it is not possible with one drug. It should be given with two or more drugs. So when two or more drugs are administered to the same person, it may leads to therapeutic incompatibility. Either it may cause antagonistic effect or it may cause synergistic effect. So the main cause is drug-drug interaction. Here the interaction between the drugs is there. So let's see one by one what is antagonistic effect. Definition. So the antagonistic effect occurs when the combined effect of two drugs is less than the effect of each drug given alone. In other words, we can say in a simple manner that one drug is going to reduce the effect of another drug, or one drug is going to block the action of another drug. We can see in the simple example like drug A, it is trying to raise the blood pressure, whereas drug B, it is trying to lower the blood pressure. When these two drugs are given simultaneously, what happens? There is a less or weaker therapeutic effect or decreased therapeutic effect. This effect is called as drug antagonism. Here we can see the specific example for drug antagonism. So we have taken the example of NSAIDs, like that is non-steroidal anti-inflammatory drugs, for example ibuprofen, and we have taken the antihypertensive drugs like ACE inhibitors, that is angiotensin converting enzyme inhibitors, which is used in the case of hypertension. So here ACE inhibitors, example enalapril is there, lisonpril is there. So what is the therapeutic action of these drugs? They reduce the blood pressure, means they cause reduction in blood pressure. Whereas NSAIDs like ibuprofen can reduce the effectiveness of the ACE inhibitors. How means by causing the kidneys to retain the salt and water. So this results in less blood pressure control. So that is called as antagonistic effect. So here ibuprofen is going to uh, reduce the effect of AC inhibitors by causing kidneys to retain the salt and water. So the main thing, that is AC inhibitors is going to act by increasing the excretion of salt from the body, whereas NSAIDs, that is ibuprofen, will enhance the restoration of the salt in the kidneys. That is what how they are going to antagonize the effect of ACE inhibitors. Similarly, here one drug is there, that is called as phenylepinephrine. The main action is nasal decongestant. It acts decongest the congested nasal route. So that is in case of cold. And the beta blockers are there, which is going to block the beta receptor in the heart, which is act as a antihypertensive drugs, means it will lower the blood pressure. Similarly, here as in the above case, phenylepinephrine, it is given in cold, which is causing vasoconstriction, that is tightness of the blood vessel. That may leads to rise in the BP, that is blood pressure. So the main action of the beta blocker is to lower the blood pressure. So when they are given simultaneously, that is phenylepinephrine reduces the effect of beta blocker, that is blood pressure may not be lower properly. So if some person is suffering from hypertension, when these two drugs are given, so it will interfere, that is phenylepinephrine will interfere in the effect of beta blockers. So that is the antagonist, that may leads to antagonistic effect of the beta blocker. That is these are some examples for antagonistic effect of the drugs. So it happens between the drug and drug, that is called as a drug and drug interactions. Types of antagonism. So the drug antagonism is of different types. It may be chemical antagonism, or physiological antagonism, or pharmacological antagonism. What happens in the chemical antagonism? Here the drug will interact chemically. So the interaction between the drug and drug is chemically, and they cancel each other's effect. For example, antacids are there, that is magnesium hydroxide is going to neutralize the effect of hydrochloric acid in the stomach. So this is the beneficial effect. So the drug antagonism, sometimes it may be beneficial effect, or sometimes it may produce harmful effect. Similarly, another type of drug antagonism is there, that is physiological drug antagonism. So here drug act on different receptors but produce opposite effects. So here also the drug interactions are there, that is the interaction is physiological antagonism. What happens here? The drug is going to act on different receptors of the body. For example, adrenaline increases the heart rate. Similarly, acetylcholine is going to act on other receptor, and it is going to reduce the heart rate, and the effect is neutralized. That is, it is not the beneficial effect, that is it may cause harmful effect. But here the drug is going to act on different receptors, that is why it is called as physiological antagonism. And in another case, that is a pharmacological antagonism. So it is another type of drug antagonism. Here one drug acts on receptor, the other drug blocks the same receptor. Here one drug is going to act on the one receptor, For example, we can take someone drug is going to act on receptor A, okay, and similarly the another drug is going to act on the same receptors, that is A. But in the above example, that is physiological antagonism, the drug is going to act on the different receptors, but in case of pharmacological antagonism, the drug is going to act on the same receptor. Means one drug is going to produce an agonistic effect. That is, here one example is there, that is morphine. Actually it is a pain reliever, it acts as pain relief, whereas in case of naloxone it blocks the effect of morphine. So the one drug is going to act as agonist, means it is stimulating the receptor, acting on that particular receptor, and another drug is going to block the same receptor. So here morphine is going to relieve the pain. Say in the same case, naloxone is going to block the effect of morphine by acting on the same receptor. For example, morphine is going to act on the receptor A, for example. Similarly, naloxone is going to block the receptor A. So that is called as pharmacological antagonism. Sometimes these antagonistic effect may be beneficial, and sometimes it may cause harmful effect on the body. Let's see what is the clinical importance. Antagonistic drugs are very useful as antidotes in poisoning. So in case of poisoning, we can use the antagonistic drug as antidotes. The best example is naloxone. It is used in case of morphine overdose, and it will reduce the side effects of another drug. So in this case, we can make use the antagonistic effect of the drug. So the one drug is going to reduce the effect of another drug. In case of poisoning, we are using as antidotes, which is the beneficial effect. Here is a simple chart is there, which is very easy to understand the concept of incompatibility. So in the column it is given the type, cause, effect and example. So type, physical incompatibility. So the main cause for the physical incompatibility or the outcome is insolubility and immiscibility. The effect, what is the effect of this insolubility or immiscibility is there is a precipitate formation or phase separation. Example is calcium salts plus sodium bicarbonate. Similarly, another type, that is chemical incompatibility. The main reason or cause for the chemical incompatibility is chemical reaction, and the effect, or we can say the result, is change in the color, and it may produce the toxic effect. The example for this is the combination of tannic acid and ferric salts. And similarly, another is there, that is therapeutic incompatibility. So the main reason cause is pharmacological interactions, and the effect or the result is failure, either failure or enhanced effect. Either the drug is going to reduce the or block the effect of another drug, or sometimes drug may get effect as a beneficial action. That is, the one drug is going to enhance the effect of another drug. Example, aspirin is there and warfarin is there, and both are working in the same way. That is, it may leads to bleeding risk. So both are going to thin the, or you can say the, both are going to reduce the viscosity of the blood, which may leads to a chance of bleeding risk. So that is what the example for therapeutic incompatibility. So, okay.